One. My guest at this time is Grace Marie Turner. She is president of the Galen Institute, one of the most respected healthcare policy firms in the country. She joins us at every major junction point of the healthcare debate, and now House Democrats are taking the first steps forward towards their goal of Medicare for all, or single-payer healthcare, which, of course, is a major promise from most of the Democratic presidential candidates as well. On Tuesday, Grace Marie was a witness before the House Rules Committee, giving her perspectives on the right and the wrong way to go about making health care more accessible and more affordable for the American people. And Grace Marie, thanks so much for being with us.
Greg, always a pleasure.
Well, we'll get into what you said and what some of the others said at this committee hearing in just a moment. But what was your overall sense of how open of a debate this is, or is this just simply going to be the Democrats pushing Medicare for all and the Republicans powerless to stop it in the House?
Well, even the Speaker Pelosi has been reluctant to get behind Medicare for all, I think because she sees how incredibly disruptive this would be to our health sector. Everybody, except people on the VA and Indian Health Service, everybody else would lose their coverage, and that means 173 million Americans with coverage through the workplace would lose their coverage. People on Medicare would lose Medicare because this will be a new program replacing it. People on Obamacare plans, people in the Children's Health Insurance Plan, all of that would be wiped out. And I think she's been very reluctant to go forward with something that seems so radical. But because there has been a lot of pressure from the left flank of her caucus to move forward, she did allow this hearing to take place. The Rules Committee is sort of the Speaker's committee. It's the last place the legislation goes through to before it gets to the floor, and it usually doesn't hold hearings like this. So this was very unusual, but it did have the Speaker's sanction.
Let's talk about one of the things you just mentioned, and that's that a lot of Americans, the bulk of Americans, would lose their coverage. The chairman of the committee, Jim McGovern of Massachusetts, sees it quite differently. I want you to listen to what he said. I know you heard it, but listen to what he said and then offer your reaction. Here's what he said.
People aren't going to lose their health care with Medicare for all. I mean, you would actually get to keep your doctors and go to your hospitals that you currently have. The only difference is you wouldn't have to deal with insurance companies. And I don't know about you, but that's not my favorite thing to do when I get sick.
If you like your doctor, you can keep it, Grace Marie. What do you make of his analysis there?
You know, that's exact. I actually said this during the hearing yesterday. I said, I think we've heard that before. If you like your doctor, you can keep your doctor. If you like your plan, you can keep your plan. Every family's going to save $2,500. I said the American people are pretty cynical about these kinds of promises, especially with these utopian promises that they are making, that everybody is going to be able to see any physician they want, go to any hospital, any emergency room, anytime, no restrictions, and the government's going to pay for it all. And they don't seem to have an understanding that there are the resources in our health sector, vast as they may be, they are not that expansive. And as a result, this plan is going to cost even more than the $32 trillion in additional spending that the other panelists that called by the Republican side, Chuck Blayhouse of George Mason University, estimates it's going to cost.
Yeah. 32 to 38 trillion, I think is what he said, over a 10-year period of time. And that's pretty close to what we heard a few months ago on that estimation as well. Here's part of your opening testimony, Grace Marie, and explaining why you believe more government is not the way to go.
I believe the growing presence of government in the health sector is a significant contributor to its dysfunction. Government officials, not consumers, increasingly determine what services can or must be covered, how much will be paid, who is eligible to both deliver and receive these services. Third-party payment systems lead to significant disruptions. Insurers and others must respond to government rules and regulation, shoving consumers to the bottom of the healthcare totem pole.
Your testimony was very interesting, Grace Marie, because you found the common ground right away and then talked about the best way from your perspective to get to those objectives for affordable and accessible health care and so forth. So we've talked about this before, but if you give the government a far smaller role in health care, how does it get better when you devolve that power to the states or to the people themselves?
I think the Democrats don't have an understanding that a lot of the problems that we have now is because of government intrusion on our health sector. The reason people don't like their individual policies, they can't pick their benefits, their deductibles are too high, their co-payments are out of sight, is because these policies are mandated by Washington. And the left seems to think that if the government could just take over the whole thing and mandate all of it, then everything is going to work out just fine. But in fact, it would absolutely crush the private sector and its ability to innovate, the ability to be able to tailor policies to the kinds of things that people actually want to purchase, and give people a sense that they once again have some control over their health spending. I think we're on a dangerous path because so many Americans are so angry and so scared and so fed up with the current system and particularly its cost, but they don't understand that a large reason for that is because of an ever larger role of government in our health sector.
Why do you think that is? You acknowledge the fact that people are intrigued by Medicare for All because they're very dissatisfied with what they've got right now. But why do you think they're willing to take a shot with government control entirely when the more government we've gotten over the last 9 years has not made them very happy?
Well, because the left is actually saying, we're going to get government out of the way. This is going to be between you and your doctor. You want to go see a doctor? Fine. Go see the doctor. Send the bill to the government. It's going to work just like Medicare. Medicare, by the way, is going bankrupt. That it is the most significant contributor to the national debt. Last year, it only took in half as much revenues as it's spent, and yet this is the program and the platform not only that they want to use to move forward with this vast new healthcare system, but to actually make it better than Medicare by having no limits, no deductibles, no premiums, no co-payments, see any doctor you want anytime you want. This utopian promise is something that seems to give people a feeling that they can have it all and the government's just going to pay for it.
Grace Marie, when we talk about the government paying for it, we often hear glowing reports on systems in Canada and Great Britain, which you and I have talked about before. There have just been recent reports about certainly elective surgery and sometimes not so elective surgery and other treatments and access to doctors being much, much tougher for folks in the UK. What can you tell us about the situation either there or anywhere else that's got more of a government thumbprint on their system?
Well, you see, and I've talked about this in my testimony, is that you see in London that people are in ambulances when they finally get one to come. They'll drive around London for hours until a slot opens up in the emergency room. Once they get into the emergency room, they may be warehoused on a gurney for days. There was a new report just last week of people dying in the hallways of the ERs because they can't get care. There's a whole think tank in Canada that does nothing but track waiting times for people to be able to get the treatment they need. It's now up to about 5 months is the average wait. When they run out of money with their global budget, which this Medicare All plan would impose, if you have a surgery scheduled for late November, sometime in December, and the hospital says, "Oh, we've run out of money. Your surgery is canceled," that you may have waited a year for, it's canceled because the hospital runs out of money, and you get in line again.
Make the connection between why a bigger government role in healthcare leads to that. How are those two connected? Because
when you have a government-run healthcare system, you have global budgets, which means that there's a fixed amount of money that's going to be spent. These decisions are politically determined, and they are determined by who makes the most noise, who has the most political power. And these decisions wind up always affecting and disadvantaging the most vulnerable people who are the sickest. They try to spread the care as thinly as possible so that everybody gets something. But if you need the newest treatments, the newest diagnostics, a complicated surgery, you're going to have a much harder battle. And that's what I think they don't understand. They think that it's going to be better for average Americans who don't use very much health care, who can just go see a doctor, get rid of all the paperwork, and it's also going to be better for the most vulnerable. It is that the system is just way too complicated to think that you can get it down to something that simple and be able to continue to keep the quality of the care that people expect in the United States, and also the relationship with doctors. Doctors are simply going to quit because one of the reasons that they expect to be able to make this go global budget is by paying doctors and hospitals up to 40% less. The government actuary has said if you do that, many of them are going to go out of business or significantly curtail services. And so you'll have fewer providers and you'll have more demand. Undocumented residents would be covered under this plan. So you'd have people flooding into the country even more than they are now for free health care. So the utopian promises are totally not realistic, but it doesn't stop them. We heard it for 6 hours. This hearing lasted for almost 6 hours yesterday. Don't worry, we can solve that.
Exit question. How did the committee leave the issue yesterday?
Well, they were all very buoyed because the Ways and Means Committee, which has significant jurisdiction in this space, decided yesterday during the hearing that it also was going to hold a hearing. There's going to be a hearing before the Budget Committee. This is what you do when you want to get legislation to the floor to vote on it. Now, not even among the 9 Democrats on the panel yesterday, there were some who were skeptical of this and want to go toward a more incremental approach. But I think that if this comes to the floor, this bill by Representative Pramila Jayapal from Washington State already has more than 100 co-sponsors in the House. It would not get through the Mitch McConnell Senate. But if it gets on the agenda, if it comes to the floor of the House, it absolutely is going to be a major issue in the 2020 presidential election campaign. And it's very difficult when they say we're going to create a whole new system and it's going to be wonderful. And the United States can do this, and it's not going to cost any more than now. And everybody's going to have all the care they need and want, and everything's going to be wonderful. How do you help people understand, folks, that's just not the way the world works. Resources are limited. Doctors will leave. We can't afford the Medicare program we have now. In other countries, we see the vulnerable, people who are the sickest are the ones who are put at the back of the list for care. That's not the kind of system we want. Yes, we have problems in this country, and we're offering a lot of solutions about how to do that, especially with our Healthcare Choices Plan. But it needs to be targeted and deliberate. Of the 28 million people currently without health insurance in the United States, 19 million of them are eligible for other programs now, whether or not it's Medicaid, the CHIP program, employer-based health insurance. About 2 million could be eligible for Medicaid, and the rest of them are undocumented immigrants. So the problem is a smaller problem. It's more targeted. We need to get government out of the way, not have more government, and have a targeted solution to the problem so we don't lose the quality and the innovation and the fine, wonderful physicians and hospitals and medical treatments that we have, because the free market invests so much in making sure our health sector continues to make progress. Medicare for All would bring it to a screeching halt and say, this is what you've got. 1965 fee-for-service medicine, you're going to get the oldest drugs, you're going to have waiting lines for the surgery you need, and good luck finding a physician to see you. In Canada, if you can't find a primary care physician to see you and you have cancer, you can't see the oncologist. Not allowed. And people, there are stories just this week about people who say their cancer progressed from stage 1 to stage 3 while they were on a waiting list. Americans will not stand for that.
The debate continues. Grace Marie, thank you so much for being with us today, and thanks for sharing your testimony with members of Congress yesterday. We'll talk to you soon.
Thanks, Greg.
Grace Marie Turner, president of the Galen Institute. I'm Greg Columbus reporting for Radio America.